Emergencies can happen anytime, and knowing first aid CPR and how to use an AED can save lives. Whether you're a parent, a teacher, or just someone who wants to be prepared, understanding these life-saving skills is crucial. Let's break down the foundations of first aid, AED, and CPR so you can act confidently in a crisis. Emergencies can strike without warning, whether at home, work, or in public places. Knowing how to respond effectively in such situations can mean the difference between life and death. Whether dealing with sudden cardiac arrest, severe bleeding, burns, fractures, choking, or allergic reactions, having the knowledge and confidence to act swiftly is crucial. First aid, automated external defibrillators (AEDs), and cardiopulmonary resuscitation (CPR) are three fundamental life-saving techniques that everyone should learn. These skills are not limited to medical professionals. They are essential for parents, teachers, office workers, and anyone who may encounter a medical emergency in their daily lives. Understanding and applying first aid ensures that injuries do not escalate before professional medical assistance arrives. Properly using an AED can help restart a person's heart during cardiac arrest, significantly increasing their chances of survival. CPR, on the other hand, maintains blood circulation and oxygen flow to vital organs, buying crucial time until emergency responders arrive. These three techniques work together to create a strong foundation for effective emergency response, helping to save lives and reduce the severity of medical crises. Importance of first aid. First aid is the immediate care given to a person suffering from an injury or medical emergency. It is the first line of defense before professional medical help arrives and plays a critical role in stabilizing the patient, relieving pain, and preventing the condition from worsening. First aid is particularly useful in cases of wounds, fractures, burns, choking, and allergic reactions, where immediate intervention can prevent complications. For instance, controlling bleeding early on can prevent excessive blood loss, and correctly managing a burn can reduce the risk of infection and scarring. Knowing how to immobilize a fracture properly can help prevent further injury. First aid is also essential in cases of cardiac arrest, where quick and decisive action can mean the difference between life and death. Beyond physical benefits, first aid training also provides psychological reassurance. People who are trained in first aid tend to be calmer and more confident during emergencies, which can positively impact the victim and those around them. Many workplaces, schools, and public areas require employees and staff to undergo first aid training. Certification programs are commonly held in offices, schools, community centers, and even online, ensuring that more people are equipped to handle emergency situations. The more individuals trained in first aid, the safer communities become. Understanding AEDs and their role. An automated external defibrillator (AED) is a portable device that can deliver an electric shock to restore a normal heart rhythm in someone experiencing sudden cardiac arrest. AEDs are designed to be user-friendly and provide voice-guided instructions, making them accessible even to individuals with no medical background. Cardiac arrest occurs when the heart suddenly stops beating due to an electrical malfunction. Without immediate intervention, brain damage and death can occur within minutes. AEDs are crucial in these situations because they can deliver a controlled electric shock that helps the heart resume its normal rhythm. The quicker an AED is used after cardiac arrest, the higher the chances of survival. AEDs are typically placed in high-traffic areas such as airports, shopping malls, schools, gyms, stadiums, and public transportation hubs. Their presence ensures that bystanders can take action immediately rather than waiting for paramedics to arrive. In many cases, emergency response times can be longer than the window of opportunity needed to save a life, making AEDs a critical component of public safety. Knowing how to use an AED is a valuable skill that can empower people to act confidently in life-threatening situations. Many first aid and CPR courses now include AED training, ensuring that more people can assist in cardiac emergencies. Public awareness campaigns and workplace safety initiatives continue to promote the importance of AEDs, helping to increase survival rates in cardiac emergencies worldwide. The life-saving power of CPR. Cardiopulmonary resuscitation (CPR) is a critical technique used to keep blood and oxygen circulating when the heart has stopped beating. It involves a combination of chest compressions and rescue breaths. Although hands-only CPR, which focuses solely on chest compressions, is also an effective method. CPR can be the deciding factor between life and death in cases of drowning, suffocation, heart attacks, and drug overdoses. CPR is vital because when the heart stops, the brain and other vital organs quickly begin to suffer from a lack of oxygen. Without CPR, permanent brain damage or death can occur within just a few minutes. By performing chest compressions at a rate of 100 to 120 per minute, CPR helps keep the heart pumping blood, providing oxygen to the brain, and increasing the chances of survival. Proper CPR technique is crucial to its effectiveness. Chest compressions should be performed with enough force to push at least 2 inches deep into the chest, allowing the heart to refill with blood between compressions. Rescue breaths help deliver oxygen to the lungs, but in situations where mouth-to-mouth contact is not possible, hands-only CPR is a viable alternative. CPR training is widely available through community programs, hospitals, and online courses. Many organizations encourage workplace CPR training to ensure that employees are prepared to respond in case of an emergency. Schools are also beginning to introduce CPR training into their curricula, ensuring that younger generations grow up with the knowledge and confidence to act in emergency situations. The history and evolution of first aid. First aid has a long history, dating back to ancient civilizations where medical knowledge was rudimentary yet essential for survival. Ancient Egyptians, Greeks, and Romans developed early forms of first aid to treat battlefield injuries and everyday accidents. Herbs, bandages, and basic surgical techniques were commonly used to stop bleeding and promote healing. The modern concept of first aid emerged in the 19th century with the establishment of organizations like the Red Cross and Street John Ambulance. These organizations created structured first aid programs to train the public in life-saving skills, making emergency care more accessible. Over time, advancements in medical science and technology have improved first aid techniques, leading to more effective treatments and better survival rates. Today, first aid training is more accessible than ever, thanks to technology. Online courses, mobile apps, and virtual reality simulations allow individuals to learn life-saving skills at their convenience. Automated external defibrillators, AEDs, and modern CPR techniques have further improved the effectiveness of emergency response. As research continues, new methods and tools will likely emerge, making first aid even more efficient in saving lives. Assessing an emergency situation. Before administering first aid, it is crucial to assess the emergency scene to ensure safety. If an accident occurs in a hazardous environment, such as a burning building, flooded area, or near electrical wires, rescuers must prioritize their own safety before assisting others. Acting without caution could lead to further injuries or endanger more lives. Once the scene is secure, the next step is to assess the victim's condition. Checking responsiveness and breathing is essential in determining the appropriate course of action. If the person is unconscious but breathing, they should be placed in the recovery position to keep their airway open. If they are not breathing, CPR should be initiated immediately. Calling emergency services should always be a priority, even if first aid is administered. Professional medical assistance is necessary to ensure that the patient receives proper treatment. If there are bystanders available, delegating tasks, such as calling 911, retrieving an AED, or providing assistance, can improve response efficiency. Training in first aid also teaches individuals how to recognize the signs of medical conditions like heart attacks, strokes, and severe allergic reactions. Knowing the symptoms and acting quickly can prevent further complications and improve survival outcomes. Emergencies can be overwhelming, but being prepared with first aid knowledge ensures that individuals can act with confidence and make a positive difference in critical situations. By understanding how to assess emergencies, provide CPR, use AEDs, and administer first aid, people can contribute to a safer and more prepared society. Managing severe bleeding and wounds. Severe bleeding is one of the most urgent medical emergencies, as a person can lose a significant amount of blood within minutes, leading to shock or even death if not treated promptly. The first step in managing bleeding is to apply direct pressure to the wound using a clean cloth, bandage, or even a piece of clothing if necessary. Firm and continuous pressure helps to slow blood loss and allows the body's natural clotting mechanisms to take effect. If possible, elevating the injured limb above the heart can further slow the bleeding by reducing blood flow to the affected area. However, if the wound is on the head, neck, or torso, elevation may not be possible, and applying direct pressure remains the best course of action. Proper wound care extends beyond just stopping the bleeding. Cleaning the wound with clean water or an antiseptic solution can help prevent infection. Once cleaned, applying antibiotic ointment and covering the wound with a sterile bandage can promote healing and protect against dirt and bacteria. For deep wounds, puncture wounds, or those caused by animal bites, medical attention should be sought immediately, as these injuries carry a higher risk of infection and complications. Treating burns and thermal injuries. Burn injuries can range from minor skin damage to life-threatening conditions, depending on the severity and extent of the burn. Burns are classified into 3 categories based on their severity. First-degree burns are the mildest and only affect the outer layer of the skin. They typically cause redness, pain, and mild swelling, but do not blister. These burns can be treated at home by running cool water over the affected area for 10 to 15 minutes. Applying aloe vera gel or a burn ointment can also help soothe pain and reduce inflammation. Third-degree burns are the most severe and involve the destruction of multiple layers of skin and underlying tissues. These burns often appear charred, white, or leathery, and they may not be painful initially due to nerve damage. Immediate medical attention is required for third-degree burns. While waiting for emergency services, covering the burn with a sterile, non-stick dressing and keeping the victim warm can help stabilize their condition. It is important not to apply ice, ointments, or butter to severe burns, as these can worsen the damage. Chemical burns and electrical burns also require special care. In the case of a chemical burn, rinsing the affected area with copious amounts of water is the first step, but it is crucial to remove any contaminated clothing to prevent further exposure. Electrical burns, on the other hand, can cause internal injuries that may not be immediately visible, making it essential to seek medical attention even if the skin appears relatively unscathed. Conclusion: the life-saving importance of first aid, AED, and CPR. First aid, AEDs, and CPR are not just skills for medical professionals. They are essential tools that can empower anyone to respond effectively in emergencies. The ability to manage bleeding, treat burns, handle fractures, and assist choking victims can make a crucial difference in life-threatening situations. Learning these skills is not difficult, but it requires proper training and practice. Many organizations, such as the Red Cross and the American Heart Association, offer certified courses in first aid, CPR, and AED usage. Taking these courses can provide individuals with the confidence and knowledge needed to take action in an emergency rather than feeling helpless. Public awareness and accessibility to first aid resources also play a key role in improving survival rates. Placing AEDs in public spaces, encouraging CPR training in schools, and integrating first aid education into workplace safety programs can create more prepared communities. By fostering a culture of emergency preparedness, lives can be saved and injuries can be prevented from becoming fatal. Emergencies are unpredictable, but preparation is within everyone's reach. Investing time in first aid training is an investment in safety. not just for oneself, but for family, friends, coworkers, and the wider community. When more people are equipped with these life-saving skills, the chances of survival and recovery in medical emergencies increase dramatically. Being prepared with first aid, CPR, and AED training can make all the difference when it matters most. Take the time to learn these skills and be ready to save a life. If you found this helpful, don't forget to like, subscribe, and share for more essential safety tips. Medical emergencies can strike without warning, and knowing how to respond can mean the difference between life and death. From heart attacks to fractures, burns to choking, each situation requires quick and proper action. In this guide, we'll go over the most common medical emergencies and the best ways to handle them. Medical emergencies can occur at any time and place, often without warning. Being prepared to handle these situations effectively can mean the difference between life and death. Quick and informed action can prevent further complications, minimize long-term damage, and, in many cases, save lives. From cardiac arrest to severe bleeding, each emergency requires a specific response to ensure the best possible outcome. Cardiac arrest and heart attacks. Cardiac arrest is one of the most serious medical emergencies, occurring when the heart suddenly stops beating. This leads to an immediate loss of consciousness, absence of pulse, and cessation of breathing. Without immediate intervention, death can occur within minutes. In contrast, a heart attack occurs when a blockage in the coronary arteries prevents blood from reaching the heart muscle, leading to intense chest pain, shortness of breath, nausea, and dizziness. In the event of cardiac arrest, the first step is to call emergency services immediately. If an automated external defibrillator AED is available, it should be used as soon as possible to deliver an electric shock to restart the heart. Cardiopulmonary resuscitation CPR must be started right away by performing chest compressions at a rate of 100 to 120 compressions per minute. Chest compressions should be performed until professional medical help arrives or the person begins to show signs of life. For a heart attack, keeping the person calm and having them sit down can help reduce strain on the heart. Loosening any tight clothing and providing aspirin, if they are not allergic, can help thin the blood and improve circulation. If the person becomes unresponsive and stops breathing, CPR should be initiated immediately. Seeking immediate medical care is necessary to prevent further complications. Stroke. A stroke occurs when blood flow to the brain is blocked due to a clot, ischemic stroke, or when a blood vessel ruptures, hemorrhagic stroke. Without oxygen and nutrients, brain cells begin to die rapidly, leading to permanent damage or death. Common symptoms include sudden numbness or weakness, typically on one side of the body, difficulty speaking or understanding speech, loss of coordination, and vision problems. The FAST method is an effective way to recognize stroke symptoms. Face. Ask the person to smile. If one side droops, it may indicate a stroke. Arms. Ask them to raise both arms. If one drifts downward, it could be a sign of stroke. Speech. Have them repeat a simple sentence. Slurred or strange speech suggests a stroke. Time. If any of these symptoms appear, time is critical. Call emergency services immediately. The best course of action is to ensure the person remains calm and still while waiting for medical assistance. Giving them food, drinks, or medication should be avoided, as difficulty swallowing could lead to choking. Quick medical intervention can minimize brain damage and improve recovery outcomes. Choking. Choking occurs when a foreign object, such as food or a small object, blocks the airway, preventing normal breathing. This is a life-threatening emergency that requires immediate intervention. A person who is choking may clutch their throat, have difficulty breathing or speaking, and their face may turn red or blue. If the person can still cough, they should be encouraged to continue coughing forcefully to expel the object. If they are unable to breathe or cough, the Heimlich maneuver should be performed. This involves standing behind the choking person, placing hands around their abdomen, and delivering quick upward abdominal thrusts just above the navel. For infants, gentle back blows and chest thrusts should be used instead. If the person loses consciousness, CPR should be started immediately, focusing on chest compressions to help push air and the obstruction out. Emergency services should be contacted as soon as possible. Severe bleeding. Uncontrolled bleeding can quickly lead to shock and death if not addressed immediately. To stop bleeding, firm and direct pressure should be applied to the wound using a clean cloth, gauze, or bandage. If available, medical gloves should be worn to reduce the risk of infection. Elevating the injured limb above heart level can help slow the flow of blood. If bleeding continues, additional layers of cloth or bandages should be applied without removing the existing ones. A tourniquet should only be used as a last resort if direct pressure fails to control the bleeding, as prolonged use can cause tissue damage. If an object is embedded in the wound, it should not be removed, as it may be preventing further bleeding. Instead, the area should be stabilized, and medical assistance should be sought immediately. Burns and thermal injuries. Burns are classified into 3 categories based on severity. First-degree burns affect only the outer layer of skin and cause redness and mild pain. Second-degree burns extend deeper into the skin, leading to blisters, swelling, and intense pain. Third-degree burns damage all layers of skin and underlying tissues, often causing a charred or white appearance. For minor burns, running cool water over the affected area for 10 to 15 minutes can help relieve pain and prevent further damage. Applying aloe vera gel or burn ointment can provide soothing relief. Severe burns require medical attention, and ice or ointments should not be applied, as they can worsen the injury. The best response is to cover the burn with a sterile dressing and seek medical care immediately. For chemical burns, the affected area should be rinsed with large amounts of water while removing contaminated clothing. If the chemical enters the eyes, flushing with clean water for at least 15 minutes is essential. Fractures and sprains. A fracture is a break in a bone, while a sprain is an injury to the ligaments that connect bones. Symptoms of a fracture include intense pain, swelling, deformity, and an inability to move the affected limb. Sprains cause pain, swelling, and difficulty using the affected joint. Fractures should be immobilized using a splint or by securing the limb in place with a cloth to prevent further movement. If a spinal injury is suspected, the person should not be moved unless absolutely necessary. Sprains can be treated using the Rice method. Rest. Avoid using the injured limb. Ice. Apply ice packs for 20-minute intervals to reduce swelling. Compression. Use an elastic bandage to support the area. Elevation. Keep the injured limb raised to minimize fluid buildup. Seeking medical care is crucial to ensure proper healing and prevent complications. Poisoning. Poisoning can occur from swallowing harmful substances, inhaling toxic fumes, or absorbing dangerous chemicals through the skin. Symptoms include nausea, vomiting, confusion, difficulty breathing, and unconsciousness. If poisoning is suspected, emergency services or a poison control center should be contacted immediately. If the person is conscious, details about the substance should be provided to medical professionals. Inducing vomiting should only be done if advised by a healthcare expert. If poisoning is caused by fumes, moving the person to fresh air is necessary. Skin exposure should be treated by rinsing the area with large amounts of water. Seizures. Seizures can result from epilepsy, fever, head injuries, or medical conditions. During a seizure, a person may experience convulsions, loss of consciousness, or uncontrollable muscle movements. The best response is to move nearby objects away to prevent injury and place a soft item under their head. They should be turned onto their side to keep their airway clear. They should never be restrained, and nothing should be placed in their mouth. If the seizure lasts longer than 5 minutes or occurs multiple times in a row, emergency help should be sought. Allergic reactions and anaphylaxis. Allergic reactions can range from mild irritation to life-threatening anaphylaxis. Anaphylaxis is a severe allergic reaction that requires immediate medical attention. It can be triggered by various allergens, including certain foods such as peanuts, shellfish and dairy, insect stings like bee or wasp stings, medications such as penicillin or certain pain relievers, and environmental factors like pollen or latex. The symptoms of anaphylaxis typically develop rapidly and may include difficulty breathing, swelling of the face, throat or tongue, rapid heartbeat, skin rashes or hives, dizziness, nausea, vomiting, and loss of consciousness. In some cases, the person may experience a drop in blood pressure, leading to shock, which can be fatal if untreated. While waiting for medical help to arrive, the person should be kept calm and monitored closely. If they have difficulty breathing, they should be placed in a sitting position to facilitate airflow. If they lose consciousness and stop breathing, CPR must be started right away. It is important to remember that even if the symptoms appear to improve after the epinephrine injection, the person still needs medical evaluation, as a second wave of anaphylaxis, biphasic reaction, can occur within hours. Hypothermia and heat stroke. Extreme temperature conditions can have severe effects on the human body, leading to either hypothermia in cold environments or heat stroke in excessively hot conditions. Understanding the symptoms and knowing how to respond can prevent serious health complications and even death. Hypothermia. Hypothermia occurs when the body loses heat faster than it can produce it, causing the core temperature to drop below 95 degrees Fahrenheit 35 degrees Celsius. It can result from prolonged exposure to cold weather, immersion in cold water, or wearing wet clothing in freezing conditions. The first response to hypothermia is to remove the person from the cold environment as quickly as possible. If their clothing is wet, it should be replaced with dry layers, and they should be wrapped in warm blankets. Applying heat packs to the chest, neck, and groin can help restore body temperature, but direct exposure to extreme heat, such as placing them in hot water, should be avoided, as it can cause shock. If the person is conscious, warm fluids such as tea or broth can be given to help increase internal body temperature. Immediate medical attention is required for severe cases, especially if the person is unresponsive or has difficulty breathing. Heat stroke. Heat stroke is a life-threatening condition that occurs when the body overheats due to prolonged exposure to high temperatures or intense physical activity in hot weather. It is characterized by a body temperature exceeding 104 degrees Fahrenheit 40 degrees Celsius, confusion, rapid heartbeat, hot and dry skin due to the inability to sweat, dizziness, nausea, seizures, and loss of consciousness. When dealing with heat stroke, the person must be moved to a cooler area immediately. Removing excess clothing and applying cool, wet cloths to the skin can help lower their body temperature. If possible, placing ice packs around the neck, under the armpits, and on the groin can speed up cooling. Hydration is crucial, but fluids should only be given if the person is fully alert and able to swallow. If they become disoriented, lose consciousness, or experience seizures, emergency medical help should be sought immediately. Untreated heat stroke can cause organ failure, brain damage, and death. Drowning. Drowning is one of the leading causes of accidental death worldwide and can occur in swimming pools, lakes, rivers, bathtubs, and even shallow water. When a person drowns, their airway becomes blocked, preventing oxygen from reaching the lungs and brain. Within minutes, unconsciousness can occur, leading to brain damage or death. The first step in a drowning emergency is to remove the person from the water while ensuring personal safety. If the person is still conscious but struggling to breathe, they should be encouraged to cough out any water and take slow, deep breaths. If they are unconscious but still breathing, they should be placed in the recovery position on their side to keep the airway open and prevent choking. Check for responsiveness and call emergency services. Open the airway and check for breathing. If the person is not breathing, deliver 2 rescue breaths. If there is no response, begin chest compressions at a rate of 100 to 120 per minute, alternating with rescue breaths every 30 compressions. Even if the person regains consciousness, medical evaluation is necessary, as complications such as secondary drowning or dry drowning can occur hours later. In secondary drowning, water that enters the lungs can cause inflammation and fluid buildup, leading to breathing difficulties that may not be immediately noticeable. Seeking medical attention ensures that any hidden complications are addressed. Conclusion: medical emergencies can be frightening, but knowing how to respond appropriately can make a critical difference. Whether it's performing CPR during cardiac arrest, stopping severe bleeding, or treating burns, having the right knowledge and training can save lives. Taking first aid and CPR courses can provide the necessary skills to act confidently in emergency situations. The more prepared people are, the safer communities become. Emergencies are unpredictable, but with the right training, anyone can be equipped to handle them effectively. Being prepared for medical emergencies is essential. Whether it's a minor injury or a life-threatening situation, the right response can save lives. Make sure to stay informed, take a first aid course, and always be ready to help. If you found this useful, like, subscribe, and share for more life-saving tips. Emergencies don't wait, and knowing how to act fast can save a life. Whether it's a sudden cardiac arrest or someone struggling to breathe, CPR and AED use are critical skills everyone should know. Today, we'll break down life-saving interventions for adults, children, and infants, because in a crisis, every second counts. Recognizing cardiac arrest. The first and most important step in any life-saving intervention is recognizing when someone is experiencing cardiac arrest. Cardiac arrest occurs when the heart suddenly stops beating, leading to an immediate loss of consciousness and the cessation of normal breathing. A person in cardiac arrest may collapse without warning, become unresponsive, and will not be breathing or will only be gasping for air. This situation is extremely time-sensitive because, without immediate intervention, brain damage can begin within 4 to 6 minutes due to the lack of oxygen supply. If cardiac arrest goes untreated for more than 10 minutes, survival chances decrease dramatically. For adults and children, the first step in assessing cardiac arrest is checking for responsiveness. The rescuer should approach the person, tap their shoulders firmly, and loudly ask if they are okay. If there is no response, the next step is to check for normal breathing by looking for visible chest movement, listening for breath sounds, and feeling for airflow from the person's mouth and nose. If the person is not breathing at all or is only gasping for air, cardiac arrest should be suspected. It is important to note that agonal gasps, which are irregular, shallow gasps, do not count as normal breathing and indicate that the person needs immediate intervention. For infants, the approach is slightly different due to their delicate bodies. Instead of tapping the shoulders, the rescuer should gently tap the sole of the foot while calling the baby's name in a loud but reassuring tone. If the infant does not respond, appears limp, and is not breathing or is only gasping, it is a sign of cardiac arrest. Infants have smaller airways and are more prone to breathing difficulties, making it critical to act without hesitation. Once cardiac arrest is identified, immediate steps must be taken to save the person's life. Calling emergency services immediately. Once cardiac arrest is recognized, emergency medical services, EMS, must be contacted immediately. The sooner professional medical help arrives, the higher the chances of survival. If there are multiple bystanders, one person should be assigned to call emergency services while another begins CPR. If the rescuer is alone, they should call for help before starting chest compressions. However, in cases involving infants and children, a different approach is recommended. Cardiac arrest in young children is often due to respiratory failure rather than heart problems, so providing immediate CPR can be more beneficial. In such cases, the rescuer should perform 2 minutes of CPR before calling emergency services, as immediate chest compressions and rescue breaths can help restore circulation and oxygen flow. After 2 minutes, the rescuer should call for help, even if they are alone. When calling emergency services, the rescuer should clearly provide details about the situation, including the person's age, condition, and whether CPR is being performed. If an automated external defibrillator, AED, is available nearby, the caller should mention this so that the dispatcher can provide instructions on using it. The emergency dispatcher may also provide step-by-step CPR guidance, which can be helpful for individuals who are not trained in CPR. Performing high-quality chest compressions for adults. Chest compressions are the most critical component of CPR and play a vital role in maintaining circulation when the heart has stopped beating. Chest compressions mimic the pumping action of the heart, helping to push oxygenated blood to the brain and other vital organs. For adults, the rescuer should begin by positioning themselves next to the person on a firm surface. Kneeling beside them, the rescuer should locate the correct hand placement by identifying the lower half of the sternum, breastbone. The heel of one hand should be placed in the center of the chest, with the second hand placed on top of the first, fingers interlocked. It is essential to ensure that only the heel of the bottom hand applies pressure while keeping the fingers off the chest. The rescuer should avoid unnecessary interruptions and continue compressions without pause, except when providing rescue breaths if trained to do so. If multiple rescuers are present, they should switch roles every 2 minutes to prevent fatigue while maintaining high-quality compressions. If an AED becomes available, it should be used as soon as possible, but CPR should not be delayed while waiting for it. Adjusting chest compressions for children. Performing chest compressions on children requires modifications to account for their smaller and more flexible rib cages. The goal is still to maintain effective blood circulation, but excessive force should be avoided to prevent injury. For children aged 1 to 8 years old, the rescuer should begin by placing one hand in the center of the chest, just as in adult CPR. However, unlike adults, using 2 hands is not always necessary unless the child is larger and requires more force. If the child is small, the rescuer should use only one hand, applying gentle but firm pressure. Compressions should be approximately 2 inches deep, maintaining the same rhythm of 100 to 120 compressions per minute. Full chest recoil between compressions is just as essential in children as in adults, allowing the heart to refill with blood properly. The rescuer must strike a balance between applying enough force to create effective circulation and avoiding excessive pressure that could cause rib fractures. If the rescuer is unsure about the amount of force required, they should focus on delivering firm, rhythmic compressions while monitoring the child's response. If an AED is available, pediatric pads should be used if possible. If pediatric pads are not available, adult pads can be used, but one pad should be placed on the child's chest and the other on their back to avoid overlap. Ensuring that CPR is performed correctly on children can significantly improve survival rates. Since children often experience cardiac arrest due to breathing issues rather than heart problems, immediate action is critical. If the rescuer is alone, 2 minutes of CPR should be performed before calling emergency services to maximize the child's chances of survival. By following these steps, rescuers can provide effective chest compressions for adults, children, and infants, helping to maintain blood circulation and improve the likelihood of survival until professional medical help arrives. Using the correct CPR technique for infants. Infants require a much gentler approach when performing CPR due to their small size and delicate chest structures. The goal of infant CPR is to maintain blood circulation while minimizing the risk of injury. Unlike adults and older children, whose chests can withstand more pressure, infants' rib cages are more flexible and can be easily damaged if compressions are too forceful. The recommended compression rate remains between 100 and 120 compressions per minute, maintaining a steady rhythm to ensure continuous blood circulation. Since infants are particularly vulnerable to oxygen deprivation, beginning CPR immediately is critical. If the rescuer is alone, they should perform 2 minutes of CPR before calling emergency services. In many cases, infant cardiac arrest results from respiratory failure rather than direct heart issues, making quick intervention essential. By acting swiftly and using the correct technique, rescuers can improve an infant's chances of survival before professional medical assistance arrives. Providing rescue breaths in CPR. Rescue breaths are a crucial component of CPR because they deliver oxygen directly to the lungs, helping maintain vital organ function. While chest compressions alone can temporarily circulate oxygenated blood, rescue breaths provide fresh oxygen, increasing the effectiveness of CPR. The combination of chest compressions and rescue breaths is known as conventional CPR and is the most effective method for most cases of cardiac arrest, especially those caused by respiratory failure. The proper ratio for CPR is 30 chest compressions followed by 2 rescue breaths. For adults and children, the rescuer should use the head tilt, chin lift maneuver to open the airway. This involves placing one hand on the person's forehead and gently tilting the head back while using the other hand to lift the chin. This position helps prevent the tongue from blocking the airway. Before delivering a breath, the rescuer should ensure that the airway is clear of any obstructions, such as food or fluid. Once the airway is open, the rescuer should pinch the victim's nose shut, seal their own mouth over the victim's mouth, and deliver a slow 1-second breath. The chest should visibly rise, indicating that air has entered the lungs. If the chest does not rise, the rescuer should reposition the head and try again. Proper ventilation is key because inadequate rescue breaths can limit oxygen delivery and reduce survival chances. For infants, the rescue breathing technique is slightly different. Instead of sealing only the mouth, the rescuer should cover both the nose and mouth with their own, ensuring an airtight seal. Since infants' lungs are much smaller, gentle puffs of air should be given instead of full breaths. Each breath should be just enough to make the chest visibly rise. Overinflating an infant's lungs can be harmful, so controlled small breaths are essential. If the infant does not respond after 2 breaths, the rescuer should resume chest compressions immediately. If the rescuer is untrained or uncomfortable providing rescue breaths, hands-only CPR, which involves continuous chest compressions without rescue breaths, is still an effective alternative. Studies have shown that hands-only CPR can still improve survival rates, especially for adult victims of sudden cardiac arrest. However, for infants and children, where respiratory failure is a common cause of cardiac arrest, rescue breaths are highly recommended whenever possible. Using an automated external defibrillator, AED, properly. An automated external defibrillator, AED, is a portable device that can analyze heart rhythms and deliver an electric shock if needed to restore a normal heartbeat. AEDs are designed to be used by both trained professionals and untrained bystanders, making them a crucial tool in saving lives during cardiac arrest. When used early, an AED can significantly improve survival rates by restoring a normal heart rhythm before irreversible brain damage occurs. Once the pads are in place, the AED will analyze the person's heart rhythm to determine if a shock is needed. If a shock is advised, the rescuer must ensure that no one is touching the person before pressing the shock button. The AED will then deliver an electric shock to try to restart the heart. After the shock is delivered, the rescuer should resume CPR immediately, beginning with chest compressions. If the AED does not recommend a shock, CPR should continue without interruption. For children and infants, AED use is also effective, but requires special considerations. Pediatric pads should be used whenever available, as they deliver a lower energy shock that is safer for smaller bodies. If pediatric pads are not available, adult pads can still be used, but they should be placed differently, one pad on the chest and the other on the back, rather than both on the front. This positioning prevents the electrical current from traveling through too small of a surface area, ensuring a more effective shock. Continuing CPR and AED use until help arrives. CPR and AED use should continue uninterrupted until professional medical responders arrive or the person shows signs of life, such as breathing, coughing, or movement. If the victim regains normal breathing but remains unconscious, they should be placed in the recovery position to keep the airway open and prevent choking. However, even if they appear to be improving, they must be monitored closely until emergency medical personnel take over. If an AED is available, it should be used as often as directed by the device. Most AEDs will reassess the heart rhythm every 2 minutes and determine whether another shock is needed. The rescuer should follow the prompts carefully, continuing CPR between shocks to maximize survival chances. The combination of effective CPR and early AED use dramatically increases survival rates in cases of sudden cardiac arrest. Studies have shown that when an AED is used within the first 3 minutes of collapse, survival rates can be as high as 70%. This highlights the importance of widespread AED availability and proper CPR training. By mastering these 8 life-saving interventions, recognizing cardiac arrest, calling for emergency help, performing high-quality chest compressions for adults, adjusting CPR techniques for children and infants, providing effective rescue breaths, using an AED properly, and continuing CPR and AED use until help arrives, anyone can play a critical role in saving lives, whether in a home, workplace, or public setting. Having the knowledge and confidence to perform CPR and use an AED can make the difference between life and death in an emergency situation. CPR and AED training can mean the difference between life and death. Whether for adults, children, or infants, knowing these techniques can help you step up when it matters most. Stay informed, get certified, and be prepared to save a life. If this was helpful, like, subscribe, and share to spread awareness.